My name is Kelly Patterson. I'm the clinical nutrition educator at OmegaQuant, and I'm going to be talking about our hemoglobin A1C test. Let's go ahead and get started. So starting off with what is hemoglobin A1C? Hemoglobin A1C is a hemoglobin protein that has glucose attached. The more circulating glucose, which is the major soluble carbohydrate source in our blood, the more glucose that's floating around in our blood and circulating in our blood, the more of it that will become attached and attracted to this hemoglobin A1C protein. A1C is just the name of this particular hemoglobin protein that attracts this glucose. And the hemoglobin A1C test, so checking measures of this hemoglobin A1C protein and how much of it has glucose attached, is primarily used in clinical settings for and as a diagnostic test and monitoring test for type 1 and type 2 diabetes. So for monitoring control of patients with diabetes. And typically this test isn't used, in traditional medical settings without someone who might be of concern for diabetes, maybe someone who's showing outward signs of potentially elevated glucose. So that's where it's traditionally been used. But we are encouraging the use of this for hopefully the prevention of diabetes, but also just for general health monitoring as well. So a little bit about glucose metabolism. So we have an understanding of the processes happening here. Talk a little bit about insulin. So insulin is a hormone that is produced by the beta cells of our pancreas. It basically shuttles glucose into the cells of our brain, muscles, organ tissues for it to be used for energy. So without insulin or without effective insulin, the glucose that we get through food and through our own production of glucose will just circulate in our blood more and more and more. The levels will get higher and higher over time. Glucose, as I mentioned, that is just the primary simple sugar found in our blood, and it's used by almost every cell tissue and body tissue in our bodies. So glucose is broken down from food, or is the broken down byproduct of carbohydrates. When we eat more complex carbohydrates or even simple carbohydrates, they are broken down, and glucose is that final small simple sugar that we use for energy. Carbohydrates, most people are pretty familiar with what carbohydrates are. They are consumed and digested. They're broken down into our smallest form. Carbohydrates can be found in a lot of different foods, fruits, vegetables, grains. A lot of people think of them coming from things like sweets and breads and cupcakes, those types of things. And that certainly is where carbohydrates can come from. But carbohydrates can come from a lot of different food sources, like I mentioned, fruits and vegetables as well, too. And carbohydrates are healthy. We want to have carbohydrates in our diet, varying degrees depending on your goals and depending on your needs. But carbohydrates are a good thing, and glucose can be a good thing as well, too. We don't want a blood glucose of 0. That definitely is not compatible with life. So glucose is good, carbohydrates are good, insulin is good, but too much of any of these things or a dysregulation in that process is where we can start to see issues. When glucose is absorbed into the tissue properly with the help of insulin, it is then metabolized through a series of reactions, through a series of processes into ATP for energy. When it's not absorbed, like I mentioned, it continues to circulate in the bloodstream. So what is hemoglobin A1C? We talked about what exactly it is. So why do we use it? If that glucose attaches to the A1C, what is it useful for measuring? So hemoglobin A1C levels are expressed as a percentage. So the percentage you see with the result, if you see your hemoglobin A1C is 6.0%, that means that 6% of your hemoglobin A1C proteins have glucose attached to them. And that number correlates to average blood glucose or blood sugar over the past 3 months because of red blood cell life cycles, which is about 120 days or 90 to 120 days. We see that glucose attaching to that hemoglobin A1c, and that correlates to your average blood sugars. This is from a study in 2008, just showing that correlation, how tight that is, that hemoglobin A1c is representative of those average blood sugars. So what's nice about hemoglobin A1c is you can take one test, one non-fasting test in the hemoglobin A1c, and get a picture of your blood sugar control over the past 3 months instead of having to prick your finger constantly. Now, if you are somebody who has diabetes or is curious in your sort of day-to-day ups and downs of your blood sugar, checking your blood sugar daily and fasting and non-fasting, things like that is really important. So if you need to do that for medical reasons, you want to continue doing that, this is just an additional thing you can do. Or if you're someone who doesn't need to be doing that, this is something you can do that's less invasive, takes less time. You're not having to do it as often, and you can really monitor those lifestyle changes or lifestyle behaviors that you're partaking in. So why do we care about any of this? Why is blood glucose a problem? So blood glucose in and of itself isn't an issue, but high blood glucose is. So over time, high blood glucose basically makes your blood really thick. And when blood is really, really thick, think about trying to suck up a really thick milkshake through a really tiny straw. The small blood vessels in our fingers, our toes, our eyes, our kidneys, those small capillaries and small blood vessels have a really hard time getting the blood through them, and they can cause damage to the lining of those blood vessels. So we lose circulation, those blood vessels experience damage, and so we can start to see disease in those areas. This is typically associated with uncontrolled diabetes for a long period of time. High blood glucose can also damage brain tissue over time and can cause atrophy in certain areas. Uncontrolled diabetes can result in kidney disease, blindness, peripheral neuropathy, which is that loss of sensation in the fingers and toes and feet, which can then lead to serious complications down the line. Chronically elevated glucose is also associated with Alzheimer's disease, other dementias, and cardiovascular disease. And the thing that's interesting about those is that you don't necessarily have to have diabetes for that to be contributing. So if you're on the higher end of normal blood glucose for a really long time, or what's considered normal, that can contribute to those issues. Also, diabetes is one of those things that can go undetected for a little while until it gets really, really bad. You can be in the pre-diabetic range for a very long time before you kind of spill over into that diagnosable diabetes, or before you have sort of an emergency event. So there's a lot of complications associated with elevated blood glucose. So what are considered normal values of hemoglobin A1c? A healthy person will have a hemoglobin A1c of less than 5.7%, okay? So 5.7% or higher would be considered in the pre-diabetic range, so from 5.7 to 6.4%. And these are the people that are very high risk for developing diabetes. Now, if you take our test and you happen to fall in this range, it is really, really important that you take those results and go see a doctor, get the results confirmed, and speak to your doctor about what you need to do. Our tests are not medical diagnostic tests. They're really just for monitoring lifestyle. And so if you do fall into these higher ranges where we might see some of these issues, it's very, very important that you discuss these with your doctor. And a hemoglobin A1c of greater than 6.4% is diagnostic for diabetes. So you would be considered diabetic, either type 1 or type 2. Again, there's a multitude of factors involved in that. And then typically A1c is used for diagnosing type 2. Type 1 is usually diagnosed with other criteria. But again, if you're seeing this A1c, if you take our test and it's that high, you really need to go speak with a physician right away. That is definitely something that you want to talk to your doctor about. So all-cause mortality and hemoglobin A1c. So this is a very, very interesting chart that shows kind of where the optimal range for hemoglobin A1C is. A lot of people, when it comes to blood sugar, they think lower the better. We always want the lowest blood sugar. I never want my blood sugar to be, I want zero blood sugar, right? And we just can't live like that. Your body will create blood sugar if you're not taking in any. So even a person who's on a very low carbohydrate or almost no carbohydrate diet, they will still have glucose in their blood because their body will make it. Our liver produces glucose and puts that out, for our cells and tissues to use. So that's definitely, we're never going to reach that unless, if you're alive, you're going to have glucose in your blood. But what's interesting is all-cause mortality is lowest in non-diabetics between 4.5% and 5.4%. Okay. So it does leave, as I said, that between 5.4 and 5.7, that higher end of normal, we start to see that tick up in all-cause mortality. Okay. And there's also this sharp rise in mortality below that 4.5%. Now, there's probably a lot of correlation here, not necessarily causation. People who have, serious chronic disease, things like cancers, other diseases, they're probably going to have really, really low blood sugar. And that's what would, lead to seeing those really low numbers. And so that's probably what is more likely to be cause for that mortality. But we don't want blood sugar to be too low. Hypoglycemia can be a problem. So we ideally want blood sugar, that hemoglobin A1C number, to between 4.5% and 5.4%. Okay. So there are many, so for most of us, we're concerned about a high A1C. That's more likely what we're likely to see. And so there are a lot of conditions that can contribute to raising your A1C, that aren't just diabetes. So obviously I have type 1 and type 2 diabetes on here. Those are type 1 diabetes really is causing the raise of A1C. Type 2 diabetes is both the cause of and a result of. Sleep disorders, but there are a lot of other things besides diabetes. So sleep disorders, really interesting that undiagnosed sleep apnea may cause a non-diabetes related rise in average blood sugars. So if you're somebody who doesn't get very good quality sleep, or you snore really loudly, it's definitely something to take a look at. Is potentially, if your A1C is high, that could potentially, or higher than you'd like it to be, that could potentially be related to that sleep issue. Chronic stress as well. Chronic elevated cortisol levels can cause increased blood glucose, both in non-diabetics and diabetics. Again, we're not going to see it quite as high in non-diabetics, but that chronic stress can definitely increase those A1C levels. Conditions like polycystic ovarian syndrome, thyroid conditions, those are both hormonal disorders. So once a rock has been thrown into our hormonal feedback loops, whether it be the thyroid hormones or our sex hormones, a lot of different systems can be thrown off, and one that is often thrown off because of its relationship to the hormonal system is blood sugar. Iron deficiency, B12 deficiency, those can cause raises in A1C. Alcoholism can cause raises and decreases depending on the severity. Things like uremia, hyperbilirubinemia, recent blood transfusions, hypertriglyceridemia, and chronic liver disease. If you have any of these conditions, it's really important to talk to a medical provider regarding your results, okay? So that it just will help put that into context. But testing your A1C regularly, especially with something like PCOS or sleep apnea or stress or diabetes, can really be helpful in monitoring your health and kind of taking control of your health. Also, as a note, there are many medications and other factors that can increase your A1C or may affect your A1C. Things like antiretrovirals, sulfa antibiotics, high dose vitamin C or E, aspirin, chronic opioid use, those can all affect those A1C numbers. So if you are someone who's taking really high dose of supplements, things like vitamin C or E, just keep that in mind when you take a look at your results. It could be, that's just something to note. Okay. So getting into lifestyle and diet. So this is primarily where we want to focus in adjusting our A1C levels. There are many different dietary approaches that can reduce circulating blood sugar. for oops, go back. There are many different dietary ways to reduce blood sugar for both diabetics and diabetics, but there are a few practices that are pretty universally effective. The first and probably most effective for the most number of people, if you're looking for somewhere to start, you feel like, oh, I'm kind of on that borderline, I just don't know where to start with my diet. Probably one of the most effective things you can do is really start to cut back on your intakes of ultra processed foods. Okay. It doesn't mean all processed foods, but ultra processed foods that are digested and absorbed really, really rapidly, which means they raise blood sugar averages and then raise that A1C in the long term. And when we're talking about ultra processed foods, these are foods that have undergone multiple removal and adding back in of different nutrients. They are usually composed of different components of food. So something like a Twinkie might be considered an ultra processed food, but yogurt would be not considered ultra processed. Although using the example of yogurt, maybe a kid's yogurt that's got all sorts of colors, that's more processed than a plain Greek yogurt, that sort of thing. So it's a scale. Some processed foods, pickles, yogurt, those things are okay. But those more ultra processed things, they're really hyper palatable, which leads us to overeat on them because they're really good. Can lead to overconsumption of calories, weight gain, and then eventually lead to that high blood sugar. So that's probably a really great place to start. The next would be reducing those intakes of added and refined sugar. If you do the first one, you're probably going to be doing this one, unless you're at home baking a lot by yourself or you add a lot of sugar to your coffee, that type of stuff. Refined sugar really spikes that blood glucose quickly and leads to higher blood sugar over time. So cutting back as much as you can on added sugar. And notice I said added. So, the sugar found in fruit comes along with a lot of fiber, a lot of vitamins and minerals. Our bodies don't absorb that quite as quickly as you would see with, adding a bunch of sugar to your coffee, right? Or say like a sugary drink, like a soda. The next thing would be increasing your fiber consumption. Fiber helps slow the digestion of carbohydrates. It reduces blood sugar spikes and increases satiety. All good things. So Americans don't eat enough fiber, or people just in general don't eat enough fiber, especially if you're kind of on the standard American diet or a westernized diet. We don't eat nearly enough fiber. 25 to 30 grams of fiber is a minimum. We should be eating at least that amount every day, and it should be more. You want to increase your fiber intake slowly. Make sure you're drinking lots of water to avoid a little GI upset in the beginning there. But yes, fiber is super, super important. The next thing is making sure we're eating protein. Okay, so this graph is really great. It's an older study. It's from 1984, but this is just a great depiction of why protein is important. Protein slows the digestion and absorption of glucose and carbohydrates. So instead of getting this big spike in blood sugar when we eat a carbohydrate by itself, if we eat it with glucose, we get a much slower rise in that blood sugar, keeping away from those high numbers. And remember, an A1C is average blood sugar, so those spikes can have big impact in your blood sugar over time when looking at average, right? And healthy fats also have a similar effect to protein. It's not quite as big with protein. Protein really is powerful in slowing that digestion, but healthy fats also slow that digestion and improve satiety. So they make us fuller. If I were to eat something just like crackers by themselves, I'm going to eat the crackers and I'm probably going to be hungry in a little while longer because they're going to digest pretty quickly. But if I were to have some cheese and meat with those crackers, or maybe some cheese and meat and fruit adding some fiber, or I had whole wheat crackers with fiber and some cheese and meat with them as well, I'm getting some fat, I'm getting some protein, I'm getting more fiber. That's going to keep me fuller and it's going to keep me away from these really big spikes in blood sugar. Bottom line, we want to try to have balanced meals with complex, high fiber carbohydrates, protein, and healthy fats are just really crucial for controlling your blood sugar long term. Limiting your processed foods and having those balanced meals. Exercise is another really, really, really powerful way to manage blood sugar. Both resistance and cardiovascular exercise are associated with decreases and improvements in A1C in both diabetics and non-diabetics. Okay. So after exercise, before exercise and after exercise, you see this is in diabetics, but there have been plenty of studies shown that the same effect happens in non-diabetics as well. A lot of people think cardio is the best way to do this, but actually resistance exercise is incredibly powerful for reducing that blood sugar. We ideally want to have a minimum of 30 minutes 5 times a week and have of moderate intensity cardio and at least 20 minutes twice a week of strengthening exercise to get that blood sugar control. The more we can do strength exercises, the more developed our muscles become, and muscles help utilize and sensitize our bodies to our insulin, and we utilize that glucose a bit more, lowering our blood sugar. So I mentioned this, but sleep, there's a really significant relationship between sleep duration and quality and glucose control. So it turns out you can sleep too much and you can sleep too little. It seems to be that the Goldilocks area is that 7 to 8 hours of sleep. Okay. Now, again, this is probably very similar to that all-cause mortality where something else might be going on with the folks who are sleeping 9 or more hours a day. You might see other disease processes, things like that. But it's just something to note that if you're feeling like you need more sleep, there could be something else going on. And that more than 9 hours a night is associated with poor glucose control. Stress is our last lifestyle factor we're going to talk about. Psychological stress can really increase the release of the hormone cortisol, which in turn increases the production of glucose. This process occurs in diabetics and non-diabetics. So when we are stressed, our body pumps out a little extra cortisol, which cortisol's main function is to increase our glucose production. That's all it does. It's really a great evolutionary mechanism, but especially because when we can have chronic stress, we can start to see that blood sugar be elevated over the long term. And managing chronic stress is really key to help with blood sugar control. So finding things that help reduce your stress is really, really important. So testing your A1C is a great way to gain insight into your body's ability to metabolize glucose. One test is great, but if you're going to make some diet and lifestyle changes, we recommend you retest every 3 to 6 months. Once you feel like you found a sweet spot, you feel like, okay, I've got a handle on my lifestyle changes. You could go down to 6 months to a year, but especially if you're going to make those changes initially, or maybe your results weren't what you thought they would be. It's really great to test a little bit more often, but only every 3 to 6 months instead of having to prick your finger all the time. So this is just a little bit of nerdy lab stuff. This is just showing that our tests, the OmegaQuant tests, our dried blood spot tests are valid. So this is compared against a validated sample, just showing that these processes are valid for our tests. Another concern some folks may have is that you are pricking your finger, putting a little bit of blood on a card and then sending it in to us. Does it stay stable in the mail? And yes, absolutely. Hemoglobin A1C is stable on our dried blood spot cards for at least 28 days. So that stability is there. You don't have to worry about your card getting too hot, too cold, nothing like that. It is stable for time and temperature. Coefficient of variability, this just means that our tests are reproducible in our lab, so that you are getting a valid, reproducible result when you can trust our tests. So how do you use our A1C test? How do you do the test? So you go to OmegaQuant.com and you can order one of these tests. Once you get your test kit in the mail, this is what you're going to get right here. This is the instruction card right from a test kit. The first thing you're going to do is go on and register your test kit at OmegaQuant.com/start. If you don't do that and you send your kit into us, we won't know whose it is. So you need to make sure you go on and register it. Then it's real simple as washing your hands, filling out the card, and pricking the edge of your finger finger. It takes no time whatsoever. It's very quick. Make sure that you've done your 3 blood drops, and then let it dry, stick it back in the mail, and send it off to us. It takes usually about 2 weeks for us to get you your results back, but you'll get your results on a portal, and you'll also get them in your email as well. Easy peasy. So in order to order those test kits, go to omegaquant.com/shop. Again, make sure you register your kit, collect your sample, super easy. Okay, that's all I have for hemoglobin A1C. Thank you.